Well, I know it's cold outside, but I had to shed the sweater. It was getting hot under these camera lights.
Yeah. Well.
Welcome back to the show, guys. We have a returning guest and kind of our resident dentist, if you would. Dr. Daniel Nickles joins us. And before we went into break, we asked one question, but we're going to hit you. Man, we got all kinds of dental questions we're going to throw at you today. The first is, at what age do we start sending a child to the dentist?
Bringing a child to the dentist. I always tell people about 1 year. As soon as that first tooth comes in, really, you need to be, let's start cleaning it. A little washcloth, a little toothbrush for the babies and all to chew on. But as soon as they can, you come, I'll say, bring them with you, let them sit in your lap, let them, start getting exposed to it. It's all about the experience. So we put them in the chair. We let them ride up and down in the chair, play with the air water syringe.
You're
Absolutely.
a kid at heart, aren't
you? I love it.
You have children.
I would sit in the dental chair and ride up and down myself if I had a chance.
It's kind of like, I hate to compare a child to a dog, but only in the sense that you have to socialize a dog. You have to get a dog around people, or they panic. If you don't get a child around this dental equipment and then you throw them in a chair, they're going to
any other kind of doctor.
And they come. I think it was your grandfather's a dentist,
yeah.
right? I mean, everything's gotten smaller. I mean, it used to be these big, units, big belt-driven hand pieces and everything, and so it's just, it's making them comfortable and understand. It's, I always tell people, don't tell them you're going to the dentist. Tell them you're going to see a friend, and then we make it fun for them when they get there, and and just keep it fun.
That's a good idea.
So,
well, it's a good attitude, and I think you've come across in your commercials letting people know that if you haven't been to the dentist in a while, you're not there to judge people. You're there to make them comfortable.
Just take care of everybody. That's what it's all about. That's why I have a job. I don't want to scare you. I want you to come, kind of hang out. I always feel like my friends are coming to see me.
But we need you to make some more profit because we need you to buy a razor.
You
haven't shaved in
I thought you enjoyed my rugged look today.
I do.
We do. Hey, let's talk about some common dental questions.
Sure.
Let's start with ye old bad breath.
Bad breath, yeah. Many causes of bad breath. I mean, all the way down to...
Probably that coffee I just had is not the best either.
It's one of those rough things. I always jump up in the morning, have my cup of coffee, and 2 or 3 times between patients to get that out of there. Just things from gum disease. You need to floss, you need to brush. People, realize you need to brush your tongue also because everybody has that bacteria in their mouth. All the way down to the things we love to eat, like Italian food with the garlic.
Garlic.
You mentioned sinuses earlier. Why do we have sinus infections? And there's even some underlying causes from liver disease. People that have a systemic thing like diabetes.
Can show up in your
shows
breath?
up, that's called,
But bad breath's better than no breath at all.
Absolutely.
But it could be a telltale sign.
It is. It's not something to like I say, if you've had something, some blue cheese, some coffee, that sort of thing. But if you notice somebody that has a chronic bad breath, there is an underlying cause. I mean, anywhere from gum disease, sinus problems. I mean,
tonsil disease. I know that's one of them.
People have tonsil abscesses. I mean, things need to be checked out and fixed.
Well, I know and we suggest regular checkups. The cleanings and the X-rays. That's about every 6-month thing, I guess, with you guys. But you also check, I think, for cancer.
Yes, sir.
Does that reflect itself in your breath at all, cancer?
Not usually. Cancer is one of those things of you need to have regular visits because it's one of those things of if it is not caught in time, 50% of people who have oral cancer will die within that first year. And by the time it hurts, it is too late. It's we look around. We always do an oral cancer screen. Look for lumps and bumps.
Do oral cancer screenings?
I hope so. I mean, I really hope so. It's just one of those things of it's you really need to look very well. Your dentist at a cleaning appointment should spend more time looking in your mouth and socializing with you. And really make sure they look over beyond the teeth into the soft tissues.
Probing around in there.
Probing around and looking, absolutely.
Very interesting.
And then the last thing, that they make those tongue cleaners.
Yes.
Do those things work?
They do work.
Okay.
The little tongue scrapers. And it's amazing when you first use one, you'll see there's a little bit
It's like a squeegee thing for your windshield, only it's for your tongue. It's kind of gross.
They don't have a tongue squeegee.
I'll bring you one.
Well, Dan, let's talk about more specific things you do other than fillings and people that have the old, let's mention fillings. Fillings, the old silver fillings.
Silver fillings,
maybe are showing and look less attractive than. Can't you whiten those up to match teeth now? Don't you?
Absolutely. Well, the best thing is what we do is we actually just get rid of them. The old silver fillings, work well for the time, but now, they have mercury in them.
I have one, so I know I have. It has to be dangerous, right?
They are dangerous because it has a poison in it. I mean, mercury is a toxin.
A ticking time bomb.
So we get that out of there. We replace it with a nice composite resin filling, a porcelain restoration, and we make the tooth look like a tooth again, and not something that's been patched. So.
Okay.
You do implants too, don't you?
Implants. I love the implants. Yeah.
Caps.
Caps, yeah.
Do you do root canals?
Do it all.
Why didn't they think of something more pleasant to call it than a root canal?
Well, it's really...
What's the canal got to do with it? You remove the root.
No, the root is still there. That's a common misconception. People go, you taking my roots out. No. Actually, I mean, all your roots of a tooth have at least one canal that has the nerve in it. So what we actually do is we're going in and we're taking the nerve out, and we fill the canal. Just like, if you have a cavity, we'll take the decay out and fill the tooth. We'll take the abscess nerve out, and we actually fill the canal.
I know you wanted to mention this, and we've kind of run out of time, but the difference between you and any other practice, because there are some differences.
Sure, absolutely. My philosophy is to educate the patient. The most important thing is your mouth and your mouth are different mouths. You're going to have a different choice, than, to choose. You come in with the same thing, and you're going to say, you know what, I want to choose this, I want to choose that. But people have, I think, too many times, a dentist choose for them. And so I want to educate my patient.
Under one roof, you're not sending them other places, and that's why they have the choices.
Absolutely.
Thank you so much, Dr.
Thank
Nickles.
You,
we appreciate it.
Here.
Good to have you, always.
Oh, my goodness.
That'd be a full beard by the time he gets back home.
It might be.
He's getting ready for Christmas again, I think.
Let's talk about what's coming up on the show. We're going to introduce you to a school that is making their students top priority, and guess what? PE as well.
And, of course, the South Carolina Auto Show, it's in town this weekend. You want to check that bad boy out. Imagine test driving, or at least pretending to test drive an exotic car like a Ferrari or a Maserati. And, of course, we do want to thank our friends at A Arrangement Florist. They're on the web at arrangementflorist.com. Beautiful flowers. Or go by and see them. Go in and smell those flowers. You can't do that on the Internet. You can smell them in person at their locations in Greer and in Spartanburg. So check it out. We'll be right back.